Welcome back to our EUS masterclass series. In this session, we will explore how to visualize the right portal vein and its branch from station 1, a crucial step in understanding right lobe liver segmental anatomy and planning hepatobiliary interventions. By the end of this video, you will know how to identify the intrahepatic and extrahepatic portions of right portal vein, understanding their segmental distribution, and confidently interpret their relationships with surrounding structures like inferior vena cava and caudate process. At station 1, that is abdominal esophageal level, we have already learned how to image the left portal system. With careful clockwise rotation and slight angulation, we can now follow the portal vein to the right side, where it divides into branches supplying segments 5, 6, 7 and 8 of the liver. In this image, we visualize both the intrahepatic and extrahepatic parts of the right branch of portal vein. A few key features to note here. The right branch of portal vein runs horizontally into the right lobe of the liver. The common bile duct is seen anterior to the portal vein. The hyperechoic diaphragm forms the superior limit of the field. The gallbladder is often visible in the caudal aspect. Here you can also identify segments 6 and 7, with 6 lying caudally and 7 lying cranially. Recognizing these landmarks is essential for segmental orientation on endoscopic ultrasound. Now, moving on to another image, we utilize two key anatomical landmarks, the inferior vena cava and the caudate process, to obtain a clear imaging window of the right lobe. Some important points here. The caudate lobe connects to the right lobe via the caudate process. This connection creates a helpful acoustic window for imaging. The right hepatic vein and portal vein are well visualized in this plane. The caudate process helps in orienting yourself relative to segment 1 and the posterior right lobe. This is one of the most reliable windows to assess right lobe vasculature, particularly when evaluating pathology in the posterior segments. Next, in this image, we trace the divisions of the right branch of the portal vein as they course through the liver parenchyma. Here, the anterior branch is seen supplying segments 5 and 8, the more anterior and superior portions of the right lobe. Look for these key structures. The middle hepatic vein runs vertically. The inferior vena cava posteriorly as a large anechoic channel. The gallbladder marking the caudal edge. Segment 5 is located caudally, while segment 8 is located more cranially. This anterior division is often targeted during segmental resections and segmental portal vein embolization procedures. Finally, this image highlights the posterior branch of the right portal vein. This branch typically divides into a lower division supplying segment 6, that's more caudal, and upper division supplying segment 7, that's cranial. This anatomical distribution is crucial because many focal lesions, particularly metastasis or hepatocellular carcinoma, often localize to these posterior segments. Understanding their vascular supply allows precise targeting for ablation, embolization, or biopsy. Let's quickly summarize the key steps in imaging the right portal vein and its branch from station 1. First, identify the intrahepatic and extrahepatic right portal vein with segments 6 and 7 clearly outlined. Use the caudate process and inferior vena cava as acoustic windows to image the right lobe. Trace the anterior branch supplying segments 5 and 8. Follow the posterior branch supplying segments 5 and 7, noting the craniocaudal orientation. Mastering these views is critical for mapping right lobe segmental anatomy and planning targeted hepatic interventions. Thank you for watching this tutorial on endoscopic ultrasound imaging of right portal vein and its segmental branch. See you in the next session.